Welcome back. You are still live with Expresso as we delve into a very important conversation this morning as we turn to health matters here on your Feel Good Breakfast Show. Borderline personality disorder. It affects the way people think and feel about themselves and about others. This obviously then causes problems in day-to-day functioning, and people with this disorder often have a strong fear of abandonment. They struggle to maintain healthy relationships and have self-image issues and have a lot of difficulty managing their emotions and behaviour. It sounds like me on any given day.
It really does.
Yeah, man, it's called the human condition. Now, this morning, clinical psychologist Amy Glover joins us in studio to tell us a little bit more about borderline personality disorder. I can joke about it because I'm convinced that we all sit on the spectrum in some way or another, especially after this last year and a half. We've all been pushed beyond what is normal completely.
But I suppose we start here when it comes to the conversation of borderline personality disorders, just expanding on it. What is it exactly? What does it mean?
Just want to touch on what you mentioned now about us all sort of being on the spectrum. And, you know, in terms of personality traits, we all display different personality traits. So I think, just want to start on that note, you know, that we all display traits that can place us into different diagnoses, but we might show one or two symptoms, but it's the cluster together that really forms a personality disorder. But, you know, with borderline personality disorder, taking a step back, you know, personality disorders, and there are a number of them, you know, they're pervasive behaviours. They're behaviours that are longer-term patterns of behaviour and instability, you know. So I think that's important to think about with borderline personality disorder, or BPD, as we can also refer to. So I think that's, you know, you kind of in your intro really did cover some of the key factors, you know, a lot of unstable relationships, difficulties with self-image and self-esteem, fears of abandonment, quite central, and then also high suicidality. So a lot of suicidal behaviours, whether that's self-harm or, suicidality is also a key feature.
How prevalent is it? And is there an age group? When you talk about suicidalities, we know that our younger generation is at very high risk from suicidal tendencies at the moment. Is there a particular age group that is more kind of dominant? And how many people are affected by this when we look at the more extreme end of that scale?
Sure. So according to the DSM, which is our Diagnostic Statistics Manual, it's in the general population, it's about 1 to 6%. So generally that's, I would say, relatively low, but in inpatient settings you would see it more about like 20% of inpatient psychiatric admissions. There might be BPD as well. So I think that then, you know, speaks to that a bit.
This is what's being diagnosed and treated.
But we also know that there's got to be a set of factors that contribute to someone ultimately being diagnosed with borderline personality disorder. What are some of those factors?
So you mean like factors in terms of how it develops?
Is it all situational? Is there a genetic predisposition?
There is a genetic predisposition, but I think one of the strongest factors is a history of trauma. So especially in early life. So, you know, history of abuse, various forms of abuse, neglect. You'll often see in a history for someone that has BPD, you know, which obviously trauma and abuse contributes to a lot of instability, and especially in the home. And, you know, that type of instability is where we're also learning about emotions. And, you know, with BPD, emotional regulation is quite an important thing, and often the dysregulation of it is one of the main symptoms, right? So in our earlier life, we are learning about that in our homes. So if there's high trauma and high abuse, high neglect, you know, our learning of regulating emotions is thrown out a bit, which then carries into adulthood.
I suppose ultimately it's one thing to identify this in someone else, but within yourself to get to a point to realise, okay, this is not just situational. I'm not just going through a rough patch, but this is something that is borderline or pushing into that disorder space. What are the symptoms that should raise a red flag?
So there are a number of symptoms. So one would be around the fear of abandonment, So whether that's real or perceived, you know, so quite sensitive to abandonment, interpersonal difficulties, so that can play out in relationships, at work, high reactivity in terms of mood or in terms of anger, the suicidal behaviour, which I mentioned, which can be self-harm or can be threats of wanting to end one's life. So those would be some key symptoms. You know, also a feeling of sort of emptiness is also a common one, and difficulties with identity. So you can see how that becomes tricky to tease out in earlier life, and, you know, normally personality emerges sort of in, you know, late adolescence and early adulthood. So it's complicated, you know, it needs to be monitored quite closely to really tease these symptoms out. If they are situational, have they shown up over time?
Yeah, is there
a trauma history? You know, that normally contributes to us being able to understand the diagnosis better or to provide one if needed.
Certainly does sound like a series of events coming together and experiences that come together and affect us in whatever way. Please do weigh in on this conversation. We really do want to hear from you. Expresso Morning Show, SABC3. Amy Glover is here. We'll be asking some more questions. We're talking borderline personality disorder.
It's my feel-good breakfast show.
Welcome back. As we rejoin the conversation, we are talking about borderline personality disorder, and clinical psychologist Amy Glover is still with us. We've put you through your paces this morning, so thank you so much, delving into all of the literature that I imagine that you have to take on board when discerning, because as we've said, there's a spectrum, yes, and there's some overlap with certain disorders, and then, of course, the day-to-day kind of situational stuff that's also making us feel a particular way. So then how do we go about actually diagnosing this disorder specifically? From your perspective, what kind of checklist will you go through?
So, you know, we are guided by the DSM, which I mentioned earlier, and, you know, that has a list of criteria that we need to look at. You know, a detailed history really allows us to see a broader picture of a patient we're sitting with or assessing. You know, so that's part of it, but it is difficult to tease out with you know, different disorders, especially in the time frame of late adolescence and early adulthood, where, you know, different symptoms can present slightly differently, and, you know, it is development at that time in any case. But yeah, you'd look at periods, like time frames of mood episodes where BPD, it's much faster, whereas things like bipolar or depression, the periods of mood disturbances are usually a bit longer. So those types of things, you'd make sure that, you know, someone isn't under the influence of a substance at the time, because that would also, you know, influence presentation of symptoms. So yes, you would want to look at other diagnostic criteria. It's much easier also to diagnose in an inpatient setting when you're able to observe the patient on a day-to-day basis, and with other professionals and other patients to also observe, you know, interactions in other relationships.
You talk about inpatient centres of that kind,
Sure.
but let's talk about treatment options. What options are available if you do have the disorder, and is it treatable?
Yes, it's absolutely treatable. Personality disorders are kind of notoriously difficult to treat, however, because they are pervasive and they are long-term usually, and there's obviously a deeper history a lot of the time, and because personality plays out in relationship. So it equally then finds its way into a relationship with a treating psychologist or treating psychiatrist. So the issues are always there, right? So they're always being played out.
It actually impacts the therapy itself.
Completely. But it's very treatable, especially with things like DBT, which is a therapeutic approach. DBT stands for dialectical behavioural therapy, which is kind of your first prize in terms of treatment for borderline personality.
Would you medicate?
Yes, medication is an option. Psychiatry would look at that, and also if, you know, maybe there are co-occurring diagnoses at the same time, those things can also be treated. Often mood stabilizers could be used, or antipsychotic medication can also be used.
Are there triggers? You've spoken about, you know, what it could stem from, for instance, trauma at that key developmental stage in the younger years. if left unchecked, what will happen? Because many people go through traumatic experiences as young people and don't end up with this kind of disorder. What are those contributing factors that then trigger the case in this instance?
I think, I suppose some factors that often happen is like loss and stress, I think might bring some symptoms to the fore. You know, because people with BPD are quite sensitive to rejection and, you know, quite sensitive to abandonment. So issues of loss, whether
even
that's
a heavy breakup or something like that could trigger it. Okay.
For sure. That can definitely exacerbate the symptoms. So I think that can definitely be a trigger, or changes in life, you know, with losses of jobs.
How about COVID?
Yeah.
Have you seen an upswing?
Yeah.
Over the last year and a half? How has, I mean, we've seen it right across the mental health board.
Yeah.
How do you think this last year of what the loss that we've all had to collectively endure, what kind of mark that's going to leave?
Sure, it's a hard one to answer, hey? I think, you know, COVID has just destabilized us all, you know, if we think about how important routine is to mental health stability and, you know, all the things that help us to stay stable, you know, our routines, our movements, our relationships, everything has been rocked. So, of course, that's going to impact.
Our money.
Yep.
Amy, and I have to ask you from your professional point of view as well, what do you think is your top tips to anyone that is suffering or going through that, but also as support if you know someone that is going through this, how do we then support them?
For sure. I think your first thing you want to do is search for DBT groups. So DBT is the therapy I was mentioning that's really indicated for BPD. So the groups are, you know, such a healing space. You know, in a space with facilitators and other, you know, patients that, or you know, people with BPD as well. So there's a lot of community and healing in that space. And DBT is a skills-based therapy. So you're learning to be more effective at managing relationships, emotions, coping, and it includes things like mindfulness. So it's a really grounding type of therapy. So I'd definitely say have a look out for that and search around for that. And for those wanting to support someone with BPD, I think remember that personality disorders are real. Yeah. You know, and I think it's difficult because it plays out in the relationship. But
especially this, yeah.
Yes, but you know, equally how important relationship security is to supporting someone with it, you know. So being consistent, having boundaries, reassuring your loved one that you're there, you know, that relationship security is very important.
Show them support in every way.
I love that. And just because you can't understand it doesn't mean that someone else isn't going through it. And often you need a neutral voice. And the South African Depression and Anxiety Group is that neutral voice. They've helped millions of people. And we really do suggest if you are feeling in any way destabilized, especially if you have suicidal thoughts, give them a call. Speak to someone who is prepared and educated to be able to help you in exactly the right way. And trust me, don't go through life thinking that you can't learn a new skill like looking after yourself, because we are designed to be able to take these on board. We're going to open the lines for your questions and comments through our social media platforms in just a moment. Amy is not going anywhere.
It's my Feel Good Breakfast Show.
Welcome back as we continue with our health discussion this morning with clinical psychologist Amy Glover, who is still with us, and she is ready to answer some of your burning questions. We are focusing on borderline personality disorder. Thank you once again to every individual who has sent through any of those comments or those questions. And Amy, thank you so much. I know we've pushed you this morning for a lot of information.
We've
really
dug deep for that information. And I think that it's also come through on social media as well with the comments that have come through. We've got one from Botselo Chauke saying, what to if you feel like the world is rejecting you? What do you do? Can you please kindly tell me, because it's hard to find out. And then we've got one that came through from Toby, and Toby was saying, Toby Porter saying, how do you live with someone who has it? And
okay, so dealing with rejection, I would assume that would be one of the skills that you would have to focus on when you talk about the prevailing kind of therapy behind it, that's a coping mechanism that they would focus on.
Yeah. Sure. So dealing with rejection, I mean, that's a part of life in a way, right? You know, we're going to face it.
Yeah.
So sometimes just sort of debunking the myths that come with rejection and what it can mean for us, you know. You know, sometimes it's a redirection, sometimes, you know, so just kind of checking that thinking, slowing it down.
Yeah.
You know, I think really important with BPD is slowing down reactivity. You know, because often there is that emotional reactivity to rejection and to, you know, different cues. So just trying to slow that process down, slow down one's thinking. You know, rejection does happen.
And you're seeing, sorry to interject, but Ms. Chalke in that comment, for example, says when the world is rejecting you. So sometimes there is the perception in one's mind that it is the world that's rejecting them when maybe a few instances have taken place.
Or maybe
like
just
that. Maybe it's one
instance,
person.
Yeah, I think, you know, with BPD, it can affect one's worldview, you know, especially if you've been exposed to trauma or, you know, maybe a very long-standing experience of rejection, which can be very real, you know, that we can then anticipate that from the world.
So you kind of, your barometer is set at that, and that's kind of how it feels every time you face it. And that's one of the joys of an entrepreneurship journey is you kind of reject it on the daily basis, so you get used to it. It's like you say, a redirection. It's almost like you feel like you're failing if you haven't been rejected because it means you're not pushing hard enough. Our second comment there, how do you live with someone who is going through this? Maybe that's a great way to wrap up the conversation is how do we support and not enable the negative kind of behaviour? What should we do?
Yeah, I think for those that are living with someone with BPD, ideally you want to, you know, be educated on it. So whether, hopefully, if there is a mental health professional involved, you know, to also seek sort of psychoeducation, you know, to also, I think the more familiar the family is around the symptoms, the easier it is to identify when this is an expression of the disorder happening, you know, because I think it can often just feel like an attack in the home, you know, if someone is reactive all the time or when there's suicidality, it's scary, you know. So I think identifying that it's part of the disorder.
And you kind of have to be mindful of that positive reinforcement for those people who are
Yes, consistency was a word that I really took out. Just one last time, those communities that people should go to connect with, to educate themselves, where should they go?
Sure. I think, you know, you mentioned earlier SADAG, so, you know, always a good resource to check out. And if there is an existing mental health professional working with the patient, then to seek them out as well for resources. Often family interventions are really helpful to get information, to learn about the disorder. There's plenty online also about borderline personality disorder.
Oh, you've been fantastic.
Great. Well done.
Amy, wow, you have been great. Amy Glover, and thank you very much for spending the time with us. You really are changing our world in that way. But something else that's changing the world is Stevie, a robot that's really joining the intensive care unit and changing the world in that way. Let's hear all about it.